Hello, hello. You're listening to the Curious Jord podcast. On today's episode, I sit down and talk with Dr. Mann from the Moncton Animal Hospital. It's quite a good conversation. We talked about all things animal related. She's a veterinarian over there. And if you want to learn more about the Moncton Animal Hospital, they have a website by the name monctonhospital.com. They also have an Instagram account. And all that good fun stuff. Just Google it. You probably know how the internet works. And other than that, please enjoy the episode.
Yeah, so I'm definitely one of those people that for as long as I can remember, I've wanted to be a vet. Definitely 3-year-old little me running around saying I wanted to be a vet. And that kind of carried with me throughout high school. So it's always something I wanted to do. I've always been interested in animals, but also science. So I was able to put those two things together to become a veterinarian. As far as education, you do need to do at least part of an undergrad before you get to vet school. So the school I went to, the Atlantic Veterinary College, requires 20 courses of an undergrad degree first. You can do that within 2 years, which is what I did. I'd say it's most common to fully complete your bachelor degree before getting into vet school. So between 2 and 4 years, and then vet school itself is 4 years. Beyond that, it's kind of up to what you want to do. So I went into work right after school, right after vet school. You can become a specialist by doing an internship and a residency, which can take more years, kind of 4 or 5 years to do that whole thing. So if you want to become board certified in something, that's the path you take. Or you can just kind of go out in the world and see what you want to see and do what you want to do. And that's how I got into exotics, as I just started seeing them and learning on my own, going to conferences, doing extra training, that kind of thing. So I'm not technically a specialist in exotics. I'm not board certified, so I can't call myself a specialist, but I do say I have a special interest.
Okay. So what falls under the category of exotics?
So the main categories of animals you see are cats, dogs, horses, food. Anything that doesn't fall into those is exotic. Cats,
dogs, horses, and food.
So anything else is exotic. So your rabbits, your guinea pigs, birds, snakes, lizards.
So those are all under food?
Those are not food. So those are exotic. So it's cats, dogs, horses, food, and then everything else is exotic.
What's under food?
Cows, chickens, turkeys.
Oh, okay.
Pigs are kind of weird because they're food, but they can be exotic as well. So I actually do see pet pot-bellied pigs, but I see pets. If they're planning on eating them, that would be a different type of veterinarian. I've
heard that there's no such thing. Well, you're going to be the authority on this, but with like pet pigs and stuff, you know, people want like the cute little ones or whatever. Aren't they all just pigs? And if you keep feeding them and give them the space, they grow and grow?
So I've only seen one true mini pig so far. So I am one of the few vets around that will see pigs, as long as they're pets. If they're going to be food, they're not under my kind of umbrella. But I do spay and neuter and do medicine on pigs. Most of the pigs I've seen are going to be 150 plus pounds. The only one I've seen that is a true mini pig, she was, I think, about 40 pounds and she was over a year old. So she's probably not going to become huge. Typically, we see them at about 16 weeks old and they're already 40 pounds.
So there is like a specific little like subspecies of miniature pig.
Yeah, you can get them. But if you're just kind of picking up a pig from a farm, it's likely going to be huge. I have worked with a 150-pound pig. I can't imagine necessarily having that in my home. They're very nice animals, but they can get really, really big.
So if someone has the pet pig, you can work on them. But if they're a food pig, you can't.
Yeah, it's just kind of what we decided to see at my clinic, per se. We didn't want to get into farm medicine. There are veterinarians that see farm animals. It's with the provincial veterinarians in New Brunswick. So they do all of the farm calls. They see the horses and the cows, and they'll actually go out to the farm and visit those animals. We work within the clinic. So the animals have to fit through our door, for one, to come see us. And we decided we just didn't want to dabble in the food industry.
Okay. Speaking of like farm animal medicine, this is like is it Dr. Paul? Dr. Paul?
Dr. Paul.
Paul?
Yeah.
I think I've only seen like a clip or two of the show, but my dad loves it. Like he mentions it every now and then. Is he like legit? Have you seen the show and stuff?
I've seen tidbits. I've never actually watched it. I know there's some controversy online. I can't comment per se because I don't watch the show. He certainly does things a different type of way than certain veterinarians would. I know there's kind of surgeries without gloves and things like that, which we necessarily don't agree with. But I also don't practice large animal medicine, so it's not something that I can comment specifically on.
Okay. So in your day-to-day, like what's the most common animal that you would work with?
Depends on the day. Cats and dogs are definitely the majority of what we see at the clinic. But at the Moncton Animal Hospital where I work, we are, I believe, kind of the main hospital that sees exotic animals. There have been days where I've seen maybe a cat and a dog, and the rest have been exotic animals. And those animals that we typically see are rabbits. We see a lot of rats. Bearded dragons are very common. And then birds, kind of depending on the day. We'll see those as well. We see a little bit of everything. Sometimes pigs. We've seen a tegu, which is quite a large lizard. And we see all sizes of snakes as well. So it's always interesting. I technically will see fish as well, pet fish. I will see tarantulas. I will see frogs. I'll see it all.
So what do people say when they bring in a fish?
I have yet to have a fish brought to me. The exam fee kind of discourages people from bringing in fish. You know, they spend $10 on a fish, and then spending an exam fee to figure out what's going on is usually a bit prohibitive for them. But the main thing we would do with fish would be talking about their environment. So testing their water quality, seeing what the water is, their ammonia, their nitrate, their nitrite, what they're eating. And then, of course, doing an exam from a distance. I'm not going to scoop the fish out of the water and touch it, but kind of looking at it, its behavior and what it looks like.
Okay. Yeah, I'm just imagining like the exam for a fish is slightly different than a cat or a dog.
It's mostly examining the water.
Yeah, okay. I mean, to each their own. People love their pets, right?
Yes, so exactly.
I want to laugh at it, but it's hard to laugh at because, I mean, people get attached and they give them personalities and everything else, right? So you just got off a shift. Mm-hmm. So what was your shift like today? So
I worked 9 to 1 today. So my clinic is open 9 to 1 on Saturdays. Saturdays are usually very busy. So they're usually pretty go, go, go. I will say this Saturday was a little bit slower, which is okay after the crazy week I've had. It's been pretty busy. So today we just kind of did some wellness exams, just checking on animals, seeing how they were. Unfortunately, we did have a euthanasia today as well, which is a big part of the job. So that is how I started my day. And then the rest was just kind of typical wellness and health checks. Okay.
What was the pet that you had to euthanize?
It was a cat.
And how does that work from sort of like beginning to, well, let's just say like it's the decision is made, like we need to euthanize this cat. The person says, go ahead. What's the procedures from there on out?
Yeah. So, we have an exam and discuss everything and come to the decision together that euthanasia is the right choice for the animal. Then depending on how much the owner wants to partake, we would get things started with the owner. I say most owners do tend to stay for the whole procedure, but there's no downside if you want to leave early. I do think that whole process is for the owner more so than the animal. So I definitely don't try to convince people to leave or stay. It's whatever they want to do. So for example, if the owner is staying, what we would do is we would borrow the animal, take it out back, give it a little injection of sedation to take some pain away, make them nice and sleepy. We put in a catheter, so a venous catheter, so we can get access directly to their vein, get that all taped up, and then they spend a little bit of time with the owner while they do get sleepy. And then once they are nice and kind of fully sedate and sleepy, I would then enter the room with the owner and the animal and then give them the injection to put them to sleep.
What's that final injection? What's that consist of?
It's pentobarbital.
And what's the system that attacks or shuts down? Like?
Yeah, so it's actually an overdose of an anesthetic medication that we don't use as an anesthetic medication anymore because of the outcome. So it just kind of puts them into anesthesia first. So our first injection is sedation. So they're nice and relaxed and not conscious and relaxed. And then anesthesia is taking it another step further. And then to kind of pass beyond anesthesia, it's shutting down the heart, shutting down the lungs, and then shutting down the brain.
Is that dosage determined by like the weight of the animal? Okay.
Yeah, in veterinary medicine, everything is done by weight. I do always think that's a little bit weird in human medicine where it's pretty much standard dosing for most people. You get a strep throat and they say, okay, here's your antibiotic. I don't remember the last time I was weighed in a human hospital. But with us, everything is by weight, because I have worked with birds that weigh 30 grams and dogs that weigh 180 pounds. So there's a very wide range of weight in what we see.
Do people usually, like, for the most part, take their pets after they've been euthanized?
At my clinic, I would say for the most part, they do cremation. So we do offer cremation, both general and private. General cremation is where they are cremated and they do not get their ashes back. And then private would be where they do get their ashes back. So the ashes are returned to the owners. As far as the breakdown of that, I would say it's pretty evenly split between people taking the ashes home and not.
What happens to the ashes? Well, if they don't choose to take the remains, what happens to the remains?
Yeah, so I do not do the cremation myself. We work with a company called Forget Me Not, and they're the one who processes all of the cremation. They're very lovely people, and they take very good care of the animals. I do not know the specifics, but I'm sure that the animals are kind of disposed of in a very respectful way.
Okay, so they get handed off to that company.
Mm-hmm.
Okay.
Yeah.
All right. I kind of chuckled when you say human hospital. Like there must be.
I suppose people just say hospital.
Yeah. But that's a proper distinction in this conversation, right? What are some other things where you kind of look at human hospitals and you think like, oh, why do they do it that way? Because of your perspective on animal hospitals. Are there other little things like that?
I mean, thankfully, I don't spend too much time in a human hospital. I do think the medication dosing is probably the biggest thing that I've noticed just with personal experience. My best friend is a human nurse, and everybody laughs when I say human nurse, but that's kind of just the habit I've gotten into. And we kind of share stories about different medications and different procedures, and a lot of it is the same. A lot of what we do in veterinary medicine, we've taken from human medicine. A lot of the drugs we use are used in humans as well, and they're human drugs. So it is a lot of the same, just kind of transferred and modified to the different animal. We do x-rays the same, ultrasounds, CT scans, MRI, all of those advanced diagnostics are available for us as well, just maybe in a different way. But we are able to do kind of a little bit of everything.
Are there instances of human physicians taking notes from animal doctors?
I don't know of any directly. The one thing I know that is nice that veterinarians have right now that human doctors don't is the Lyme vaccine. So we actually do have a vaccine for Lyme disease for dogs, and there's not one available for humans. There's definitely way complicated reasons for that. Lyme disease is much more severe in humans, so I'm sure there's a reason. But that's one of the things, I always wonder, why do we have the vaccine for dogs and what's going on in the human world that's kind of making that challenging for them.
I'm just like simplifying. Do animal doctors ever call on human doctors to come over and give expertise or opinions or?
I haven't encountered that, but I have heard stories of human dentists helping out with advanced dental procedures, root canals, things like that. Certainly veterinarians can train on those themselves, but I have heard stories not directly from direct colleagues or anything like that, but of dentists in particular kind of helping with procedures like that.
Okay. So you obviously deal with people as much as you deal with animals.
Yeah.
So let's talk about that side of it. Is there any training during your schooling with regard to the psychological aspect of dealing with the owners?
Not nearly enough. I know things have been changing since I left. They were talking about kind of integrating more communication and client interaction training into the school. There certainly was some when I was there. But I can definitely tell you that if you want to go into veterinary medicine because you don't like people, it's not the place for you. You deal with people 24/7. That's all I do is talk to people and work with them. I thought it was going to be my least favorite part of the job, but it's kind of turned into my favorite. I really, really love my clients. They're great to work with. And without them, we wouldn't have the animals. We wouldn't be able to do what we do. But certainly the training as far as communication and interaction with clients when I was in school wasn't the best. So once I first started working, it was certainly an adjustment, but it comes quickly.
So what's one of the biggest things you've learned about people over the course of working with animals?
Just don't read a book by its cover. You never know who's going to spend $3,000 on their bearded dragon, or who is going to, drive a Lexus and not want to do blood work on their dog. It's really hard to anticipate how the day is going to go, or what people are going to say yes to or no to, or why, what their reasoning behind it is. Some people don't want to do blood work for the money, and other people don't want to do it because they're scared of what they might find. So you never know what kind of the motivation behind people are.
Have you ever found an instance of owners imposing their religious beliefs on their animals?
I haven't yet, thankfully.
Okay.
I'm not sure how I would deal with that. But it's certainly, you have to, do what the owner wants, and ultimately they're the decision makers. Yeah. So you have to respect that.
Yeah. I was just wondering in terms of blood transfusions and euthanasia and that kind of thing, right? Mm-hmm. Or those sorts of things.
Yeah. It's not something I've had to encounter yet.
Okay. How do you find this impacting yourself, psychologically? Are you bummed out at the end of the day sometimes? Or how do you unwind or deal with that?
Yeah, so it's a very stressful job, but I love it. I do love it. A lot of days, I go home feeling great, and some days I don't. I'm not sure if you're aware, but suicide, unfortunately, is very prevalent in the veterinary community, both with veterinarians and with support staff, for a number of reasons. It's not something I personally deal with, but I do have to be aware of kind of the wear and tear and the stress of the job. The ways I deal with it predominantly is rock climbing. I find that's what I've found to kind of take the stress out of the day. So if I've had a really bad day, if I'm tired and I just want to go home, I go rock climbing instead. And that takes a lot of the stress out of my day. It is very hard to separate yourself from your job when you work a job like this. When I first started, I would go home at the end of the day and all I would think of was, did I do the right thing? How are my patients doing? I really want to know if they're taking their medication okay. Are they getting better? I've gotten a bit better at separating, but it's still very hard. I mean, I care about these animals as much as the owners do.
Mm. Okay. That's cool, the rock climbing thing. It's good to decompress and have your own way like that. Yeah. For reptiles, what drew you to those specifically? So,
again, for as long as I can remember, I liked weird animals. Yeah. I'd always wanted a snake. My parents said no, because most people don't like them. When I moved out for school, I kind of forgot about it for a little while. And the summer before I got into vet school, so the summer after my second year of undergrad, I decided I was going to get a reptile of some sort. So I went to the pet store and I fell in love with a bearded dragon. So I got my bearded dragon. And he was sick because I got him, from a pet store, and he had been exposed to various things. And he had some parasites, and I had the hardest time finding a veterinarian that would help me. So I went to school in Prince Edward Island, and there are a few vets there now that will see exotics. But when I had him, it was almost 6 years ago now, there wasn't really anybody. So there was a lot of struggle just trying to find somebody who would give me medication for his worms. So that was kind of the day that I said, I'm never going to turn away an animal because it's weird. After I'd had him for a year, one of my friends was moving away and needed to find a home for their snake. So then I took in a snake, and I still have my snake. Unfortunately, my bearded dragon passed away. But I do still have that snake, and she kind of keeps me going with the reptiles and encourages me every day. So.
How long are snakes good for?
Depends on the snake. So I have a corn snake, so she should live about 20 years, hopefully.
Oh, wow.
She's 10 now. But then Western hognoses, for example, are another snake I have experience with. They tend to live a bit less long, about 15 years.
This is sort of a simple question, but I don't understand it. So what's the difference between cold-blooded and non-cold-blooded? Can we talk about that for a second and really just break it down for me? So
your cold-blooded animals are your reptiles, and they can't control their body temperature. So they don't sweat. They can't shiver and control things. So you and I are warm-blooded. So we go outside in the cold. Our body's not going to drop to negative 10 degrees like it is outside. We have some sort of way of regulating our body temperature and making sure we don't die or freeze to death. Reptiles can't. reptiles take on the temperature of the environment. So that's why it's very important when you own a reptile to know what temperature they should be kept at, to make sure you're monitoring it, keeping them heated. So in the winter, making sure they have all of their heating elements, sometimes in the summer, depending on the animals as well. Because if you put a reptile out in negative 10 degree weather, the reptile will be negative 10 degrees.
So how warm does your snake have to stay?
So frustratingly so, all of my reptile temperatures are in Fahrenheit, so it's a little bit difficult that way. But she ideally stays around 80 degrees. She likes to kind of have a warm side of her tank and a colder side of her tank, so we set up a little gradient. So right now she does have her heat lamp on for the winter. That's kind of how I know that winter has started, when I have to turn my snake's lamp on.
Okay. 80. So what's that, like 25-ish?
Yeah, it's like just above room temperature.
Okay.
That's her ideal spot. But she does have like a little warm spot in her tank as well. It's warmer.
And you know that she prefers one or the other just based on her behavior?
Yeah, where she hangs out.
Okay.
She strangely enough, is kind of a cold lover. She stays on her colder side for the most part.
Yeah.
Every once in a while, she'll go to the warm side, but she likes it a little chilly.
What do you feed her?
Rats.
Alive rats or?
No. So I purchase my rats already killed, and I keep them in my freezer. So I live an interesting life. But yes, so I keep them in my freezer and I defrost them for her.
Right next to the popsicles.
Yeah, honestly. At least they're in a bag of their own.
Where do you get dead rats?
So I purchased them actually from a breeder over in Prince Edward Island.
Okay.
They kind of deliver them to New Brunswick and Nova Scotia. It's East Coast Exotics. That's where I get my feeders from, and I do recommend them.
Okay, and then you can ensure that they're like a quality food source.
Yeah.
That's why you get them there. Interesting. Okay. So say someone brings in their reptile and they are behaving unnaturally or odd, what would be the examination process for, let's just say, a snake for the example's sake?
Yeah, so for the most part, you extrapolate from a cat or dog or human. So you start from an examination from a distance. So how are they acting with the owner or in their enclosure or things like that? Are you noticing that they're holding their body weird, that there's any swellings? And then, of course, I get a weight on the animal, see how much they weigh, and then I start handling them. So it's a little bit different depending on the animal. Most of the snakes I work with are fairly small, so easy to handle. You always want to keep an eye on the head of any animal, but especially a snake, because they can kind of whip around pretty quickly. But I start with my snakes with just feeling up and down the body, making sure that their muscle tone is good, making sure they have control of their body, feeling in their abdomen as much as possible. So you can actually kind of palpate up and down their stomach, see if there's any lumps or bumps in there. And then I do look at their face and I look in their mouth as well. So depending on the size of the animal, using a cotton swab or a popsicle stick to open up the mouth and have a look in there. And then depending on what we find with all of these animals, we can do blood work, we can do x-rays, we can do all sorts of different testing on them as well.
Okay. So can you give an example of an issue you would find with a snake and how you would correct it?
Yeah, so the most common issue I see with snakes are upper respiratory infections. So you'll see them kind of blowing bubbles out of their nose, having issues breathing, opening their mouth to breathe, which is not normal. And typically they're not as energetic and they're not eating as much when they have these illnesses. It's a course of antibiotics that we would use for these guys. With snakes, it's typically injections because getting oral antibiotics, so antibiotics by mouth, into a snake can be interesting. So we do actually teach the owners how to give injections. And if they're comfortable, they do them at home. And if they're not, we can always do them in clinic for them.
Okay. How does it work with the cold-blooded aspect and giving them an injection of something? Does that have to be a certain temperature, the injection? So
we just make sure the injection's about room temperature. We don't want to make it too cold or too warm for them for sure. And then the most important part is making sure that the snake is the right temperature so that they're being housed comfortably, not too cold. If they're too cold, their metabolism is going to slow down and they're not going to heal properly. So keeping their temperature, in the upper end of normal when they're sick is really important.
Yeah. Have you ever been bitten by stuff?
Yes. The most common animal to bite me actually is birds. So I've been bitten by many, many birds. That would be the most. The only other thing I can think of is I was bitten by a cat once, but birds predominantly. Okay.
I wonder, is bite even the right word for a bird? Like pinch?
Yes.
Yeah?
Yes.
Okay. All right.
Yeah. Thankfully, I haven't been bitten by any of the larger parrots, but they could do some serious damage.
Have you ever seen that? I forget the formal name of it, but I think it goes by terror bird.
No.
No? Oh my God. Anyone listening and yourself, Google terror bird. It's just this giant, it's alive now, but it looks like a prehistoric creature. The beak on it is, it's massive. It's probably like half a foot long, and like the end of it, it's like a curved claw type thing. It's horrifying.
Wow.
But apparently they just like stand in one spot all day and just grab fish.
Oh, well, that's fine then.
And stuff, but
could probably do some damage if it wanted to.
Oh yeah, it's horrifying. So like, do you do surgeries as well if you need to operate on an animal?
Yep. So at my clinic, I do surgeries 2 or 3 days a week. For the most part, we do surgeries on cats and dogs and rabbits, which predominantly is spays and neuters. We can do those on pretty much any animal. So I have spayed and neutered cats, dogs, guinea pigs, rabbits, pot-bellied pigs. I have done surgery on birds and reptiles as well, not spaying and neutering, but I have done surgeries that come up. So pretty much for the most part, any soft tissue surgery, so not including bones, is something that I would be willing to do. The only bone type surgery that I do personally is amputation. So removing a tail or a limb. I have done a tail amputation on a bearded dragon before. But as far as like fixing fractures and doing back surgeries, that's beyond my scope personally.
Which one of the lizards, in quotes, grows its tail back?
So there are a few, but the most common one that you would think of would be a leopard gecko. There are some other geckos that drop their tails. Not all of them grow them back. So eyelash crested geckos, they can drop their tail, but it won't come back.
Okay. Do you just have the snake now, or do you have a bunch of other pets?
I have the snake and a cat.
Okay. Do you ever want to have, I would think that you would come home and like not even want to see animals.
Some days. Yeah. And my cat is very, very needy. So some days it's hard coming home to her screaming at me and chasing me around the house, which is in part why I think of myself as a reptile person. My snake is there when I want to go see her. I do think I'll get another bearded dragon at some point. And my partner wants a dog, but he's been told he has to do the training because I think coming home to train a puppy after being at work for, 8 to 10 hours would be quite stressful. But my animals do give me comfort too after those bad days. Even if, I'm tired of seeing animals, I still love them.
Okay. What would you say if I said dogs have loads of personality and snakes and lizards have absolutely none?
I wouldn't disagree. Dogs have more personality than reptiles. I can strongly say that. As far as like lumping lizards and snakes together, that's where I would say you're wrong. I would say lizards really do have personality. I saw it come out a lot in my bearded dragon. They can definitely, have desires and things they like better and just they have spunk, and I really loved my little guy. He had personality for sure. Could I tell you my snake has personality? Not definitively. I think she knows who I am. She knows who my partner is. And she knows when a stranger is holding her.
Really?
That's about it. She has places she likes to go and things she likes to do. But as far as a personality, I'm not convinced.
Okay. Yeah, I've never owned one. I kind of wanted a snake. But once again, I think my parents were like, no.
Yeah.
I held one. I remember we had like a reptile guy come to school, it's pretty classic. And I had the snake, and it was, I liked it. It was cool, but also a little creepy. I got like a vibe of you could turn on me.
That's why I like them, because they're so strange. Like they are creepy in a way. Like, how are you moving without legs? I just love watching them move. Yeah. I love watching her just move around the tank and move around the room. And I just think they're fascinating. I think reptiles in general are fascinating.
Yeah, they're pretty cool. Like I like looking at them, but I don't think I want one in the house,
That's understandable.
Yeah. What's going on with rabies? Is that still prevalent and happening? Like
it's still happening.
Okay.
There have actually been reports of it in New Brunswick recently. So rabies is here. I do recommend that all cats and dogs, regardless of their lifestyle, be vaccinated for rabies. My cat, for example, never goes outside. She's terrified of the outside world, but she gets her rabies vaccine because you never know what could happen. Somebody could leave the door open, a bat could come in, the cat could go out. and the chance of exposure is always there. It's a very safe vaccine. And then you're kind of protecting yourself. If your dog or cat does bite someone, it becomes a legal issue, especially if they're not vaccinated for rabies.
So what are the symptoms of rabies?
Rabies. So there are a few types of rabies. The main two are kind of the furious form and the dumb form. The furious form is kind of what you think of when you think of rabies. The animal gets crazy. So they're kind of hyperactive. They're drooling and frothing at the mouth, and they're wanting to bite things. The dumb form is they're just sick. They can't really move around much and just kind of sit there. I thankfully have not experienced a case of rabies, and I hope to never see it. But that's because vaccination is so prevalent here. And I know there are kind of wildlife baiting programs where they provide rabies vaccines for wildlife as well.
Okay. Have you ever seen any instances of, just realize I keep saying instances. Have you ever seen a situation where an animal was like self-harming itself?
Only with situations like licking themselves because they're sore or itchy. So I guess like an animal is going to scratch at itself beyond, causing wounds. So things like that are, I would say, fairly common with allergies where they're scratching and they're scratching and they're scratching and they're making themselves bleed. But that's more because there's a reason for them to be doing that type of stuff.
Like mentally or just
physically?
Hurts?
So when we see like a dog licking at its paws until the point where it has a wound there, it either has underlying arthritis or it's really itchy, things like that. There can be behavioral causes where they're bored and they'll lick themselves compulsively because they're bored.
Okay. I once worked on a turkey farm and I lost so much respect for turkeys. Not that I had a whole lot anyways, but if one got like a sore on it or something, all the other ones would just start pecking at it.
Yes.
Why? Explain.
So that's something that I see with chickens. I've never worked with turkeys. Turkeys kind of scare me, honestly.
They're frightening.
Yeah. So I have not directly worked with herds of chickens, but I have been involved with kind of friends who have family members that have large amounts of chickens. So I've seen it kind of firsthand. When you're in a group situation like that, any animal that is weak is going to, increase your chance of failure. So it's going to make you as a pack less likely to survive, more likely for predators to get in. So they go after the weak and get rid of them so that there's no weak in the group.
Crazy.
Yeah.
Turkeys, man. I still have nightmares. Have you ever worked on like any dolphins or sharks or sea life of that nature? No.
In vet school, I helped perform a necropsy on a whale and a sea turtle. So those are autopsies, but for animals. So I guess in the afterlife, I have, but never live. No.
Okay. What was that like?
Really fun.
Yeah?
Yeah, I really, really do enjoy necropsies, especially on strange animals that you don't get exposure to a lot. The main point of a necropsy is, of course, to determine the cause of death. But you also learn a lot about, the anatomy of the animal and the lifestyle of the animal. You can find with the sea turtle, like what were they eating, what's in their stomach, things like that. So it's always
straws, really apparently.
Yes.
A lot of straws. When you were in school, did you do a lot of like dissection on animals?
Yeah. So our very first year, we do start anatomy class, and that's when we start dissecting animals to learn the specific ins and outs of anatomy, knowing every single nerve, every single vessel, bone, muscle, the name of every single individual part of the animal. It's very tedious, but of course, very important. You need to know those things to know how a live animal works. So that's predominantly in first year. And then in fourth year, our final year, we work a lot in the postmortem department. So helping determine cause of death with different animals.
Okay. I was watching a video on YouTube earlier, and the channel was called Vet Ranch, I think. Okay. Have you ever seen that?
I haven't. No.
Oh, okay. I guess I didn't watch a whole lot of it. It just seemed like a show where they follow vets and stuff. And in the one I watched, there was a young dog. It wasn't a puppy, but he had like a gash on his belly. And he suspected that there was like some muscle damage like underneath. So he took the gash and he had to cut it open further just to kind of see what was going on. Mm-hmm. But I found it, I couldn't look at it. Like I'm squeamish now for some reason, but yeah. I was dumbfounded by how nonchalant he was. He just like sliced it open and the camera's right there and he like hauled the skin back and he's like, see, like we got a bit of damage here. And I was trying to imagine like that would never happen with a person. Like it didn't seem totally respectful on his part to be doing what he was doing. But yeah, it almost just seemed like, I don't think there's a question here, but it almost seemed like it was just, he was so nonchalant about it that because it was an animal or something. I wonder, like, do you guys have like a sense of urgency when you're in there operating, or is it kind of like just a little bit off from a human because the dynamic is different where it's an animal in quotes and not like an animal human?
I think that I treat them the same way as I would treat a human being. I could never work in human medicine. I think humans are gross. That's one of the reasons why I'm a veterinarian. Gross, yeah. Because not too much grosses me out as far as animals are concerned. But every life is a life, whether it's a fish or a dog or a human. So I certainly, feel a sense of urgency if there is something urgent, and that animal's life is my main concern in that moment. So I certainly like to think I treat them the same as I would a human.
Mm. What would be a piece of advice that you would give to somebody if their animal's sick and they're coming to the vet to just help them get along and to help your life or make your life a little easier? What would be some advice?
I guess my biggest piece of advice would be to try and work with us, work with not only your veterinarian, but the whole team at the clinic. We are there to help you. I want the best for your animal as much as you do. I'm not trying to get you to spend unnecessary money or do unnecessary testing. What I recommend is what I think is best for the animal and what is going to let us figure out what's going on and what is going to help. Definitely being, honest with your veterinarian as far as what your expectations are financially, emotionally, how far you want to go. It's always good to kind of think of beforehand, but just work with us. We're there to work with you and figure it out.
Are you vegetarian?
I'm not.
No?
No.
So you can eat pork chop, you can eat burgers, you don't care. It's just like a separate thing. Yeah.
I mean, I know that there are veterinarians out there that are vegetarian, and that's their choice. I have nothing against that. But on the other hand, I know there are veterinarians out there that are watching our food source and making sure these animals are, being taken care of properly and raised properly. And, for the most part, other than outliers, making sure they're not being abused. And there are laws in place and veterinarians that help with it. A large part of my schooling was on food animals. So learning about cows, beef cow, dairy cattle. So I know there's a system out there and it's not always the best. Certainly I think there are things that can be improved in the animal food industry, but.
What about is a scorpion an insect? No.
I do not know the direct answer to that question.
I don't think it's. I'm trying to think of the word for it. Oh well, I don't know. Have you ever had to work on a scorpion?
I would work on a scorpion. Yes. Yeah.
Jeez, I don't know. Yeah. Okay. I think that'd be crazy. To have someone bring their scorpion in and they're just like, oh, here's Gus, he's not acting.
I mean, I'll be honest, there's not going to be a whole lot that we can do with a scorpion. You can certainly take x-rays. They have an exoskeleton, so that's going to make things difficult. You can't do blood work on them. So there's very, very limited things you can do with a scorpion. Kind of the same as a tarantula. There's things you can do and things you can't. It's limited, but there are always ways to help.
If you took an x-ray of something with an exoskeleton, would it just come up solid?
Yeah, it's not going to help you.
Oh, wow. Yeah.
It would let you know if there's breaks in the exoskeleton. So if there's a fracture along the way, but you're not going to be able to assess their organs very well.
Would you have to do an MRI or something on it?
Yeah, CT scan.
Wacky. Do you have any good vet jokes?
I don't know. I'm sure I could think of some, but I don't know if I would say they're good.
Okay, no, none of them are good. I looked up some earlier.
No, of course, my manager always puts some little jokes and puns on our signs. If you ever do drive by the Moncton Animal Hospital and look at our sign, there's usually some jokes on there.
Okay.
But they're, the typical dad jokes.
Yeah.
Which aren't bad.
No. The one I heard was, or the one I read, and I might mess it up, but it was, what do you call a veterinarian who only works on one species? A doctor.
A doctor.
Did you know that one?
I did.
Yeah. All right. Cool. I don't have any other questions. That was awesome. Very cool. Moncton Animal Hospital is where you work.
Yeah.
If people are interested, or if they want to find it more, or they have a sick animal, that's where they can head. There's probably a website or something. They just Google it too, right?
Yes, we have a website. We have a Facebook page and an Instagram as well.
Cool. All right. Well, thanks a lot, Nicole.
Yeah, no problem. Thanks for having me.
Hello again. Thanks for listening. I just wanted to add a couple things at the end here. A couple little side notes or fact checks or something, I mentioned the bird, the terror bird in this, and we were kind of looking it up or whatever. The terror bird was a real thing, but it is extinct now. The bird that I was thinking about is called the shoebill. So if you look up the shoebill bird, that's also frightening, but very much alive. And towards the end, we were talking about scorpions and what category or species of animal or subspecies, I don't know my terms, or which one they fall under. And it's not an insect. It falls under the arachnid family. So you can sleep well tonight knowing those two facts are correct. Anyways, thanks again for listening. If you want to hear more episodes, you can go to curiousjord.com, or wherever you download your podcast, you can search Curious Jord and find all of the older episodes. Anyways, take care. Bye-bye.